The silence surrounding miscarriage often amplifies the pain. Globally, around 23 million pregnancies result in miscarriage each year. Despite how common this is, the subject of miscarriage remains a societal taboo. This can leave many feeling isolated and, for some, emotionally traumatized. Misconceptions about miscarriage further add to the stigma, causing individuals to wrongly blame themselves for the loss. However, most miscarriages occur due to factors beyond personal control, and are usually unpreventable. Pregnancy is an intricate process that requires precise coordination between the fertilized egg and the uterus. In fact, only 1 out of every 3 fertilized eggs results in a live birth. Let's explore what happens within the body during the first 12 weeks of pregnancy, a period when most miscarriages occur. Pregnancy is sustained by several key hormones, progesterone and estrogen from the ovaries, and human chorionic gonadotropin, HCG, from the fertilized egg. During the initial half of the menstrual cycle, estrogen levels rise, followed by progesterone. These hormones prompt the uterine lining to thicken and increase its blood supply, preparing for potential pregnancy. If the egg isn't fertilized, hormone levels drop, leading to menstruation. But if fertilization occurs, the egg's outer layer produces HCG, which signals the ovaries to keep releasing progesterone and estrogen, preventing menstruation. HCG also helps the fertilized egg by binding to receptors in the uterine lining, preventing its rejection. This phase is often where things can go wrong. For reasons not fully understood, up to a third of fertilized eggs fail to implant properly and are naturally lost, often without notice as part of a regular menstrual cycle. For fertilized eggs that successfully implant, further challenges arise. Once attached, the fertilized egg's rapidly dividing cells depend on its DNA to guide development. Chromosomal abnormalities can halt this process, leading to irregular growth or stopping development altogether. Many mistakenly believe factors like stress, exercise, or even previous birth control use cause miscarriages, but the vast majority are due to genetic or other uncontrollable health factors. Some miscarriages cause little to no physical symptoms, while in other cases, HCG levels drop, followed by progesterone, resulting in bleeding and cramping. In these situations, 3 treatment options are available, 2 of which are also used for induced abortion. The first option is the watch and wait approach, where the individual waits for hormone levels to drop and the pregnancy tissue to be naturally expelled. This method is effective 90% of the time, though it can result in unpredictable pain and bleeding for several weeks. The second option involves medication, using mifepristone and misoprostol in sequence. The first drug blocks progesterone receptors, while the second induces contractions, softening and dilating the cervix. This process usually takes between 1 to 6 hours and can be managed safely at home. The third treatment, known as vacuum aspiration, involves a healthcare provider numbing the cervix and using a thin tube connected to a syringe-like device to remove the pregnancy tissue. This procedure only takes about 5 minutes. Treatment choice typically depends on medical history, personal preferences, and individual circumstances, and all 3 methods are both safe and effective. However, without access to treatment, incomplete miscarriages can lead to dangerous infections and hemorrhage. Since these treatments overlap with those used for abortion, they may be harder to access or even criminalized in certain areas. On top of this, over half of the global population lacks access to reliable healthcare, including these vital reproductive services. Pregnancy holds different meanings for people at various stages in their lives. For many, losing a pregnancy is a deeply painful and overwhelming experience. During such a difficult time, it's crucial that everyone receives compassionate care and has access to these essential, life-saving treatments.